Sam, we're having some technical issues with you. We're going to get right to Sam's forecast in just a few minutes. But first, thank you for staying here. Mark Spivak, who's the director of the emergency department at UofL Health, is here to talk to us about a big issue that's going on right now, substance use disorder. More than 40 million Americans over the age of 12 suffer from this. Thank you so much for being here, Mark. And tell us why this is such an important issue. And I guess there are misconceptions about substance use disorder.
There are, thank you. One of the biggest reasons to kind of work with reducing the stigma for this patient population is just to try to help them. They need our help as much as anybody else, and it's so important for us to know how to do that.
If someone is having the issue, what kind of help can you provide?
Well, number one, within the hospital, we can obviously provide medical assistance. We can get people started on various medications like Suboxone to help them through some of that. In addition to that, we've partnered with many people in the community, including 7 counties, Louisville Metro Public Health, and Peace Hospital, to get them to the next step once they're actually discharged from within the hospital.
How does it get to a point where someone has the disorder, when it becomes, this is what's wrong?
So after a period of time and we see them come through the emergency departments, get admitted, we actually start to identify that, and the doctors diagnose them with those illnesses. So,
But I mean, is a lot of it pain management? What are we talking about here?
Yes, often they come in with terrible wounds, you know, and so then we look it over and we identify the fact that clearly not only are they using the medication prescribed to them as intended, but then they're also going above and beyond. And that's where we start to find that there really is a problem underlying.
Right, that's kind of where the stigma comes from.
That's exactly right.
People need this help, they need to feel better, but then they get hooked on it.
They do. And what we find is oftentimes people, some of the misconceptions we find in healthcare is that people necessarily don't believe that it's a real illness, or they do believe that the patient can quit whenever they want. And we know that's just not true.
And I know UofL has been very involved in this. You've got a symposium that is coming up at the end of this month. Let's talk a little bit about it. Tell us about, first of all, where's it going to be happening? So
the symposium will be at UofL Health Shelby campus, located on Hurstbourne and Shelbyville Road.
Sure. I think a lot of folks in Louisville know where that is.
Absolutely.
And so what will be happening at the symposium?
So at the symposium, we're lucky enough to have 5 different lectures going on. We'll have Dr. Stewart with the Department of Psychiatry. We'll have Sam Katzman. She's our pharmacist, and she'll talk about how to properly treat pain management for this population. We will also have a panel discussion with 4 people with lived experience, and they'll come talk to us about how they felt when they came to the hospital asking for help and how we treated them in return. And we'll also have Killian from Louisville Metro Public Health talking about what are the resources available there. And so he can talk to you about everything in harm reduction.
Certainly the resources are so important, but I would think that panel would be very important to people who are going through this, to know that they're not alone.
Absolutely. And that's one of the keys to this entire symposium, is to allow people to know, hey, this is where I was and this is where I am, and this is how I felt when I came asking for help.
Okay, and we want to take a look one more time at that symposium that is at the end of the month. If we can put up the full screen on that real quick so people can find out about it. It's from 8:30 to 3:30 on January 31st. Again, as you mentioned, it's over off of Whittington Parkway, that's out at the East End campus.
Yes, ma'am, it is.
All right, well, thank you so much for being here, Mark. We appreciate it. Very important issue.
Greatly appreciate it.
All right.